In Lagos, Governor Babajide Sanwo-Olu says no going back on the school's resumption as second wave of COVID-19 worsens. He attributed safety from domestic violence as the major reason from insisting on reopening of the schools. Adejoja Salam Adeni reports.
This is the Lagos State Governor's first COVID-19 briefing for the year.
The epidemiological update.
Top on his agenda was the school's resumption that has come with mixed reactions. Schools in Lagos reopened on Monday, 18th of January, with the new staggered system introduced by the government to reduce the number of pupils at all schools. Governor Sanwo-Olu explains the rationale behind the school's reopening in the face of the positivity rate of COVID-19.
Last year, after the first lockdown, kids have to come back to school, we're still looking for about 24,000 children that have not come back to school. We just don't want to throw them because they will just be roaming and they become endangered. You know, you've seen incidents of, child abuse, all sort of, unprintable things that are being done to these children. So we believe to a large extent that schools sometimes happen to be the safe haven for them.
Figures from the NCDC shows Lagos has 41,400 confirmed cases out of the 32,000 cumulative tests conducted. The state government has discharged 32,296 patients and lost 276 people. But 8,828 patients are still on admission, and most of them require oxygen therapy. The governor says with the behavioral pattern of the second wave of COVID-19, they have decentralized the availability of oxygen across 10 centers of the state.
Of these 10 centers have been commissioned, whilst the remaining 5 will be ready within the next 3 to 4 weeks. And of course, it's important for us to mention that the 5 that has been commissioned are inside the MCC at Etiosa, the MCC at Alimosho. They are purpose-built oxygen triage centers. At Koka Aguda Primary Health Center, at Mushin General Hospital, and Isolo General Hospital. Additional 2, one will be sited at Bagada General Hospital, and the other one with the PPP will be sited at the Lasut Hospital in Ikeja.
The state testing capacity has now increased from 3,000 to 4,000 per day. The incident commander urged people who have malaria symptoms-like to visit government facilities for free testing and immediate management.
In this second wave of the current pandemic, any malaria-like symptoms should be considered as a COVID-19 virus infection unless and until otherwise proven, either by doing a proper malaria test or by doing a COVID test. And so any infected individual with COVID-like symptoms should proceed to any of our public health facility and or laboratory to get tested.
Governor Babajide Sanwo-Olu also urged residents of Lagos to live and act responsibly by wearing their face masks everywhere and also follow the social distancing guidelines and other safety protocols to flatten the second wave curve before the arrival of the vaccine. Adejoja Salam Adeni, TVC News, Lagos.